question.
Yeah, no.
So I'm not answering with a question, right? Okay, let's see about that. I'm happy to help you out with this. So tell me what you know about your insurance company so far and why you'd want let's see what they cover first, the pre-authorization.
I know they cover $1,500 a year for me.
Okay, so you got a maximum, we know that, $1,500. Your plan is, how much did we tell you your plan was?
$3,000.
$3,000. Well, if they follow through on their part, then that's what we do all day long. We get that $1,500 for you. The only time it doesn't happen is when they start getting really cheap. And insurance companies are about what? They're about making money. They got the biggest buildings in the city, right? And so they're not a healthcare provider like we are. So what I want to do is two things. I want to look at the total cost, but I also want to look at, hey, they followed through, they delivered on the $1,500, and now you're just looking at $1,500. Can we do both of those things first?
Yes.
All right. I want to show you something. This is an example of a pre-authorization I got back from a patient a few months ago. Well, look at the part I circled there. See that asterisk? What does that say?
This is not a guarantee of payment.
Not a guarantee of payment. So I send this in for you. They send back, somebody says, oh yeah, we'll pay $1,500. And then at the bottom, they put that on there.
It's a little deceiving.
It's deceiving, yeah. So are there any guarantees of what they're gonna say?
No.
No, there's no guarantees. So I wanna plan for both, okay? So let's look at $1,500. So let's say we go through this, we build the insurance at $1,500. I gave you the three options. Which option are you wanting to do? What's comfortable for you?
I would like to do payments.
You want to do the payments. So we do 12 months, no interest. So we do this. Now it comes back and they say, nope, we're not paying all. Maybe they don't pay $500 more or whatever it is. Now what do you want to do?
I'd just be able to work that into my budget.
Try to put it in the budget, okay? And we can do something there. We can help you out with putting it on the care credit and do those sorts of things, okay? We can do that. So here's my real question for you. By doing this, the insurance company delays how much they pay and when. They're saying, send us this, so you have to wait 6 weeks to get your care. I know you and Dr. Porva talked about getting the fractured teeth taken care of before it turns into a toothache. Now we're waiting 6 weeks for them, right? There's the delay. Now you take on more risk. Now you end up having to have a root canal. Now you're paying more than the $1,500 out of pocket. This is what we don't want to have happen. This is what we don't want the insurance company to defeat us, right? So let's be a team together. How about this? We get you scheduled while we send this out, knowing it could be either or, it could be good or bad, but they're probably going to say, yeah, we cover it, and then go ahead and do it, right? And then by the time we've heard back, we've already got you scheduled and we're moving through with things. Maybe not all of the things, but some of them. How does that sound?
Sounds great.
You're okay with that?
Yes.
Okay. Any other reason why we shouldn't go ahead and get you scheduled? Okay. So, look,